You know how an X-ray is basically a photograph of your insides, right? Well, what if you could shoot a movie inside your body instead? That's exactly what fluoroscopy is. It's this incredible tech that gives us live-action X-rays, and today we're going to break down how it all works.
Right, so a normal X-ray, it's awesome for looking at, say, the structure of a bone. But what if a doctor needs to see how that bone moves in its joint? Or, tracks something moving through your body, like a contrast dye. You can't do that with a single photo. You need a video. And that is precisely the problem that led to the invention of fluoroscopy.
Okay, so what is it, really? It's simple. Fluoroscopy is a moving, real-time X-ray. I mean, think about it. If a regular X-ray is a picture, fluoroscopy is a movie. And that lets doctors do what they call dynamic studies, which is just a fancy way of saying they can watch how your insides are working and moving, live on a screen. Pretty amazing, right?
So that brings up a good question. Why wasn't a still photo enough? Let's dig into why seeing things in motion is such a big deal in medicine.
Well, the biggest issue with a regular X-ray is that it's, static. It's just one single moment frozen in time. But our bodies, they're constantly moving, constantly in action. Think about your digestive system or your blood flow. A single snapshot just doesn't cut it. Doctors needed to see the whole movie, not just one frame.
And this need for a moving picture led to some, let's just say some very early and frankly kind of dangerous inventions. The beginning of this technology was a really dim and difficult road.
So, let's go back in time. The year is 1896, and the person behind this is a name you'll definitely recognize, Thomas Edison. He came up with this really clever idea. He thought, hey, instead of using a photographic plate to capture just one image, what if I point the X-ray at a screen that glows? And boom! Just like that, he created a live, moving picture.
And wow, take a look at this. This shows you just how far we've come. On the left, you've got those early setups. I mean, they look clunky, barely shielded, honestly pretty sketchy. And then on the right, you see a modern digital suite. It's sleek, it's controlled, it's super advanced. The difference is quite literally night and day.
But yeah, those early days were rough. I mean, look at this list. First off, the images were ridiculously faint. So faint, in fact, that radiologists had to sit in a totally dark room for like 20 or 30 minutes wearing these special red goggles just so their eyes could adjust enough to see anything. And on top of that, you had a huge radiation dose for the patient and really, really bad image quality. It was a dangerous, difficult process for absolutely everyone in the room.
So obviously that was not a sustainable situation. Something had to change. A huge breakthrough was needed, and thankfully, it came along in the 1950s. It was an invention that would change absolutely everything: the image intensifier.
See, the main problem was super simple. The image was just too darn dim. And the solution? A process with a pretty straightforward name: image intensification. And this was going to turn the whole field upside down.
And this is the hero of our story: the image intensifier tube. It might look complicated, but this vacuum tube was designed to do one absolutely incredible thing. Take that super faint X-ray image and crank up the brightness by thousands of times.
So how in the world does this thing work? It's actually a really clever four-step process. Okay, step one, the X-rays pass through the patient and hit a special screen, the input phosphor, and get turned into light. Step two, that light then hits another part, the photocathode, which kicks out a bunch of electrons. Step 3, those electrons get sped up and focused into a tight beam. And then the grand finale, step 4, those supercharged electrons slam into the output phosphor and bam, you get an image that is thousands of times brighter than what you started with. It's just genius.
And this chart, it just lays it all out, doesn't it? Look at the difference. Image brightness goes from very poor to high. The radiation dose plummets from high to low. And the viewing method, we go from sitting in a dark room with goggles to just watching a TV screen. I mean, it was a complete and total game changer.
Okay, so this is great. We have a nice, bright image, but it's still stuck inside this tube. The next big problem to solve was, how do we get that image out so that more than one person can see it at the same time?
And the solution was actually pretty simple, especially for that era. You literally just pointed a TV camera at the bright screen on the end of the tube. And just like you see here, the camera sends that image right to a TV monitor. Problem solved.
And this simple fix solved two massive problems at once. For one, no more sitting in the dark, but the even bigger deal was that now the entire medical team, the radiologist, the surgeon, all the nurses, They could all look at the same live image at the same time. This was a gigantic leap forward for teamwork and for patient safety.
But hey, the story doesn't stop in the 70s. Of course not. The next massive leap came with the computer revolution, when fluoroscopy finally went digital.
So let's circle back to this picture of a modern setup. The last piece of the puzzle was getting rid of that old-school TV camera and replacing it with a sleek digital detector, basically the same kind of tech you'd find in a really nice digital camera today.
And the benefits of going digital were just huge. We're talking way faster image capture, we're talking instant storage and sharing, no more tapes, and now you have the power to actually tweak the image after the procedure is done. You can brighten it, mess with the contrast, zoom in, it's incredible. And importantly, all of this tech helped lower the radiation dose for patients even more.
Now, today, there are basically two flavors of these digital detectors. You've got indirect detectors, which kind of work like the old system. X-rays turn into light, and the light turns into a digital signal. But then you have direct detectors, which are even cooler. They just skip that middle step altogether and turn the X-rays directly into a digital signal. Super efficient.
So let's just do a super quick recap of this whole journey, right? It all starts way back in 1896 with Edison and his dim little screen. Then the 1950s bring us the absolute game changer, the image intensifier. The 70s hook that up to a TV so everyone can watch, and then the 2000s bring in the digital detectors that power the amazing systems we have today. What a ride.
I mean, when you really stop and think about it, it's wild. This technology went from a faint, dangerous glow that you could barely see in a dark room to a crystal-clear, high-definition digital video that surgeons use to guide their hands in real time. It's just mind-blowing. It really